everyone for taking time to join us this morning to learn about the Pulse of Rural Manitoba reports. My name is Michael Asante. I'm the research and data manager at RMED and also a co-author of the reports. We acknowledge that our branding office is located on 32 lands, the traditional homelands of the Dakota, Anishinaabe, Ojibwe, Crew, Dene, and the Métis people. However, we work extensively throughout Manitoba in the lands of Treaties 1 through to 4 and the southern portion of Treaty 5. Our RMED respects the treaties that were made on these lands where we work together. We commit to reconciliation along the path to economic prosperity. I am pleased today to be joined by members of the RMED team. We have Devin Stekailo, our EDA, Economic Development Advisor. We have Teddy, who is here, Teddy Gavi, our Project Coordinator, Eric Foster, our Economic Development Advisor as well. Introduce our speakers for this morning. John Olamide Oladele is a sustainability and climate change researcher at the Rural Development Institute with a strong focus on translating data into practical policy and planning outcomes. With a master's degree in rural development alongside advanced training in geography and environmental studies, bringing a multidisciplinary perspective to climate mitigation, adaptation, and sustainable development. John has several years of experience conducting applied community-based research across Manitoba, collaborating with municipalities and public sector partners. His work examines municipal climate planning and the role of data in rural context, identifying trends, patterns, and alignments with broader sustainable development goals. A key area of focus is exploring how smaller and rural communities navigate constraints in climate and sustainable planning. John's strength lies in data interpretation, policy analysis, stakeholder engagement, and translating complex research into clear, actionable insights for decision makers. John is also interested in bridging the gap between research and implementation, ensuring that climate strategies are not only well designed and funded, but also practical, relevant locally, and sustainable in the long term. Our second presenter is also called Shalane Gunaratan. So Shalane is deeply committed to building inclusive, resilient, and thriving communities across rural Manitoba and beyond. Her personal journey as an immigrant, combined with over decades international experience, gives her a real grounded perspective on rural development, newcomer integration, and community well-being. With over 15 years of working experience in Sri Lanka and 3 years in Canada, Shalane brings expertise in rural and community economic development, leading community-led initiatives across emergency response, relief, and rehabilitation, and socio-economic projects. This experience, combined with her expertise in project designing, monitoring, and evaluation, has equipped her with a uniquely practical and people-centered approach to development work. She holds a Master's of Arts in Rural Development from Brandon University. As Immigration and Community Wellbeing Research Lead at Brandon Rural Development Institute in Brandon, she leads research on immigration, climate adaptation, AI, and women's entrepreneurship. Concurrently, as Project Coordinator at Community Futures Westman, she advances financial empowerment through the Lending Cycle program. At the core of everything, Shalane believes that lasting change begins within communities themselves. Her vision is that communities should not be recipients of development, but active architects of their own futures, equipped with skills and capacity to build something that truly lasts. We also want to acknowledge the presence of Wayne Kelly. Wayne is the director of RDI. He's online this morning, and we really appreciate his presence. Quickly. All right, so this morning we want to talk about the Pulse of Rural Manitoba reports, which was launched, I think, some few weeks ago. For the purpose of the report, we would like to give this land acknowledgement. Today, as we talk about community well-being, we respectfully acknowledge that we live and work on Treaty 1 and 2 lands, the traditional homelands of the Dakota, Missinaibi Crew, Oji-Crew, Dene, and the Métis people. It is important to note that Indigenous peoples in Canada, First Nations, Inuit, and Métis take a holistic view to community, and there the concept of capacity, roles, and overall well-being is central to both community and development for Indigenous cultures. Before we dive into the findings of the report, I want to take a moment to also acknowledge the partners and funders that made this work possible. This research was a true partnership between RMED and RDI, the Rural Development Institute, bringing together complementary expertise in rural economic development and applied research. But I especially want to also emphasize that this project was made possible in significant part through funding from My Tax Accelerate. Without My Tax support, this work simply would not have been able to be possible. My Tax Accelerate is a program that connects academic research capacity with real-world organizational needs. And in this case, it enabled us to dedicate the research time and analytical work and collaborative effort required to build the Pulse of Rural Manitoba report. So a sincere thank you to My Tax for funding this project and to RDI for partnering with RMED. Why the post exists? Let's start with why the post exists. Our RMED core mandate is to support rural economic development through data research and helping communities build capacity. And we've been doing this work for, let me say, for almost 6 years now. We are already providing communities with data and support for support planning and decision making. So currently, when you go to our website, you are able to see that we've provided access to community profiles for our communities. The Pulse is the next step in that journey, working in collaboration with RDI. We've also developed this tool that adds a thematic lens to the data we provide. And so it assesses communities across major themes like demography, economy, infrastructure, and quality of life, giving municipalities a comprehensive, comparable snapshot of where we stand. So it's not about replacing what we already do, but we are trying to enhance it. The Pulse brings together data in a way that makes it more usable, more comparable, and more relevant to the specific realities of rural communities. And so naturally, it is an evolution of RMED's mandate. So how does the Pulse build on the work we've already done or we are already doing? There are 5 key ways it advances RMED's mandates and the reason why we committed to funding and doing this research. Each one adding incremental value to what communities already have access to, as I said. First, it improves access to data. We've been providing data to communities, but the Pulse takes this further by consolidating multiple sources into one single thematic resource. Instead of working across different reports and different data sets, communities now get one comprehensive view of how their communities are doing. Secondly, it also strengthens local decision making. And so the Pulse is aimed at providing localized, comparable insights. So communities are able to benchmark themselves against other communities, support funding applications, and advocate with real numbers. That comparability is something that didn't really exist before. And so this is the first time we are trying to bring this data together in this way. Third, it builds municipal capacity. Working with RDI, we've also designed a Pulse to kind of translate complex data into decision-ready format. So it is not just about the raw numbers. It is structured around themes that matter most. So demography, economy, infrastructure, quality of life, and so forth. The idea is that as time goes on, we are going to review these indicators and then add more to it. And so the fourth reason is that it supports evidence-based policy and investments. And so when programs, policy, and resources are grounded in real current conditions, the outcomes are better for everyone. And finally, the Pulse positions RMED alongside RDI as a data leader in the province. It establishes a province-wide evidence base and lays the groundwork for future Manitoba index. So we are planning to also in the future develop a Rural Manitoba index based on these Pulse of Rural Manitoba reports. This is the first phase, but we envision that there will be more phases coming up. I will therefore now let's Shelleen continue from here and talk about a bit of the work RDI is doing.
Thank you, Michael. So before I go into the presentation, I want to briefly explain why this research matters to RDI and where this research sits within RDI's mandate. One of RDI's research pillar is community resilience and well-being. This pillar focuses on empowering rural Manitoba with local place-based research and data and knowledge to build resilience and strengthen the well-being of its people and places. Through this research, RDI made local data available for rural communities so that they are in a better position to understand their current reality, identify gaps and opportunities, and plan locally to build better rural communities. I believe that this is the first time for rural municipalities across Manitoba to have access to consolidated data sets. Besides, this research is not only about producing the local data. RDI is also committed to building the capacities of rural communities to read the data, understand it, and apply it, so that they are better equipped and empowered to drive their own development from the ground up. RDI and RMED made sure that the Pulse report is an evidence-based living document which could be compared with upcoming census data, as well as could be improved by adding more indicators and new data sources. For example, the data sets we use from Statistics Canada's census are from the year 2021, and it would be interesting to see the growth of the municipalities by comparing it with upcoming census of 2026. Next slide, please. So, although Statistics Canada's census profile and RMED's dashboard provided us with valuable data, there are few challenges that still remain. There is a lack of easy access to universally available non-demographic or economic indicators. Beyond population and income data, information on things like how climate preparedness, and community capacity is hard to find, and it is inconsistent and spread across multiple platforms. This makes it difficult for municipalities to get a complete picture of their communities. There are not enough tools for comparing or contextualizing municipal data as well. While Pulse report provides a strong foundation for comparing municipalities with their neighbors and understanding where they are standing within their region, the numbers alone do not always tell the full story. The local context is also essential to truly understand what is driving the trend behind this data. For example, the municipality of Victoria Beach in South East region recorded the highest population growth of 73.1 among the all rural municipalities in Manitoba when comparing the data from 2016 to 2021. But the real context behind this number is that pandemic drove seasonal cottage owners, remote workers, and retired people to convert their vacational homes into permanent residencies. This is a clear example why data without context can be misleading, and why understanding the story behind the numbers is is just as important as the numbers themselves. So these are some of the challenges that we are hoping to address through future research work as well. Next slide, please. So how we did this research work? First, we developed 37 indicators across 10 themes. We also compared the indicators we developed with the Canadian Wellbeing Index or OECD Better Life Index and other well-being data sets across Canada to ensure the indicators selected are relevant, comparable, and reflective of what matters most to the rural community's well-being. We use Statistic Canada's geographic series and census profiles, RMED databases, municipal websites to gather data for these indicators. Then we analyze the data, the averages, median, minimums, and maximum values as well. We also compare the data within the themes as well as with Winnipeg and overall Canada to identify patterns and stories. Finally, the preliminary findings were shared at Western Canada Economic Forum with municipal staff, other provincial government officials, local organizations to get feedback before we finalize the report. However, we came across some limitations as well. The data is often scattered across multiple platforms, and there were no uniformity in the data collection across all municipalities for certain indicators. So we had to drop few indicators because we couldn't obtain or the data collected could not be verified. Next slide, please. So these are the 10 themes that we selected to gather data for rural municipalities in Manitoba. They are demographics, housing, economy, migration, transportation, capacity, climate change, tourism, connectivity, and well-being. Though we targeted 10 themes with 37 indicators, we were able to gather complete data for 7 themes and 29 indicators only. For example, the theme connectivity, we couldn't gather sufficient consistent data to do the analysis. Therefore, in the Pulse report, we only included 7 themes as the data across the rural municipalities were consistent. But we will be collecting data in future for the indicators for which we couldn't gather data in this round as well. Now I hand over to John to share some of the key research findings. Thank you.
Thanks, Sherilyn. As my colleague has just highlighted, this study explored several themes shaping rural development. I'll be briefly focusing on 4 of them: demographics, economy, housing, and capacity. One thing became very clear very quickly under the study, that these themes were not separate issues. They constantly influence one another, and understanding this connection is very essential for rural development. Now, quickly onto the first theme, demographics. The key findings under this theme was that rural Manitoba, its population varied by region, with some regions experiencing rapid growth, while others were experiencing stagnation and decline. Additionally, the rural community's aging population was also high compared to their urban counterpart. Next slide, please. So, as we can all see from this diagram, apart from the Parkland region, all other 6 regions are experiencing a growth, a surge in population, and the Parkland region is experiencing a decline. Next slide, please. When we think about development, we often assume that large populations automatically lead to stronger economics and better outcomes. However, the Pulse data told a more complex story. Population does not necessarily mean development. Let's quickly look at the Southwest region as well as the Parkland region. The population for the Southwest is above 100,000 and continues to grow, while the Parkland region has slightly above 40,000 and was the only region to experience a slight decline in population, as we just saw in the previous slide. When it comes to housing prices, Southwest they have a higher price, hinting at affordability challenges. And in terms of income, this was relatively modest in the Southwest. But when we looked through the data we got under the North Central region, they had a lower population than the Southwest region, but its household income was actually greater than the its household income was actually greater than the Southwest. And when it came to the ratio for business establishment, this was quite similar across both regions, with the Parkland region and the Southwest region having 1 businesses per 24 people. At first glance, it might seem that the Southwest is automatically better positioned for development due to its high population, but that is not the case. Next slide, please. Another important demographic factor to consider is the age structure. Across rural Manitoba, the working age population remains the largest age group, providing the backbone of the labor force and economy. However, regions are aging differently. Parkland, this has the highest proportion of seniors at 25.7. It also has one of the lowest youth population and the lowest working age population across all these regions. In comparison, there is the capital region, which has the strongest workforce base, with 66.3 of its residents residing in the working age category, despite having a lower population than the Southwest region. So this actually matters a great deal because age structure, this affects labor availability, it affects economic growth, it affects housing demand, it affects healthcare needs, and even influences municipal services. This further proves the point I stated earlier on that development is not simply a function of population size. It is much more than that. Workforce characteristics, migration patterns, housing market, economic specialization, and even municipal capacity. These are all factors that also matter. A region that is shrinking, a region with a workforce that is shrinking, and also a region with aging population. Such a region will struggle to attract businesses, it will struggle to maintain growth, and it will struggle to sustain services over time. And this raises an important question. If population alone does not determine development, what actually does? So this brings us to the next theme I will be talking about, economy. Next slide. Thank you. Under this particular theme, the Pulse study discovered that rural Manitoba had a varied median household income, whereby the highest levels were positioned in the capital region due to its proximity to Winnipeg, which is a major urban area. Also, the findings show that municipal population does not determine how many businesses it has. In fact, many smaller, less populated regions have a surprisingly strong business presence. This tells us that rural communities are more economically active than their population numbers might suggest. The employment landscape for rural Manitoba is heavily dominated by agriculture, and its occupational structure is also dominated by sales, trades, transportation, equipment operations, and business and finance. Next slide. In terms of median household income, which is actually one of the indicators under this particular theme, the capital region has one of the smallest regional population, yet it has the highest median household income in rural Manitoba. This suggests that economic strength depends on more than population size. Location, workforce characteristics, access to market, and even regional connectivity, all this plays an important role. Next slide, please. Additionally, the relationship between the number of business establishment and population also supports the idea that I mentioned earlier that high population count does not automatically mean strong economic activity. Regional structure, connectivity, business concentration, all of this matter just as much as population size. A quick example would be the Interlake region. It has a population of over 90,000 people, and yet the number of businesses in this region is at 3 businesses per 1,000 people. And in comparison, we have the South Central region. It has a lower population than the Interlake region of over 90,000 people, but has the highest number of businesses at 43 businesses per 1,000 people. And this is the highest across all these regions. So basically, in simple terms, people support businesses, but businesses also attract people. And as people move into communities, they need somewhere to live. And this brings me to the next theme, housing. Housing. This becomes the pressure point. This is where many demographic and economic pressures become visible. The Pulse study showed that rural Manitoba has a low density and ownership-based rural housing structure. It also discovered that a large number of apartments were found in larger municipalities, while smaller municipalities have little to no apartments. In terms of housing prices and rent as well, this was very high across major rural cities, while remote regions such as Parkland and even specific parts in the Southwest region, they had lower housing and rental costs as well. When comparing occupancy rate with total housing stock, like houses and apartment, it showed steady demands and tight availability. Next slide. Now, let's quickly compare capital and the Parkland region again. The capital region has the highest housing price, it has the highest rental cost, and also the highest occupancy rate in rural Manitoba. And why is this? It's because it combines strong income, a large working age population, combines economic opportunities, which is linked to Winnipeg, and also its continued population growth. The result is greater demand and pressure on the housing market. Parkland, on the other hand, has the lowest housing price and is also among the lowest among the regions with the lowest rental cost. While the affordability might seem positive at a glance, it actually reflect lower demands, slower population growth, and even weaker economic activity. This points out an important lesson, the lesson that housing price is not simply about affordability. They often reflect broader demographic and economic conditions. We can then say that housing therefore becomes a consequence of growth and a factor that influences future growth. If workers cannot find housing, employers may struggle to recruit staff. If families cannot find suitable homes, population growth may slow down and decline. Housing is not just a social issue, it directly affects labor attraction, economic growth, migration, and even community sustainability. So beyond identifying housing challenges, addressing it is also another thing that needs to be considered. And this brings me to the last theme I'll be quickly discussing today, which is capacity. So capacity, this is the hidden factor behind development. It is one of the most important findings from this Pulse study because capacity determines whether communities can respond to opportunities and challenges that they face. Capacity includes education, workforce skills, municipal staffing, and even community development expertise. Next slide, please. The findings from the Pulse study show that when it comes to capacity in rural Manitoba, the number of completed college certificates or diplomas and apprenticeship certificates were twice more as high when compared to university level credentials like bachelor degrees, masters, or even PhD. This suggests a strong skilled trade workforce, but it also suggests fewer highly specialized professionals. Next slide, please. The data also showed that the total number of administrative and community development staff was around 667 for an average of 5.3 per municipality. When it comes to capacity as well, regional differences exist. For example, the Interlake region has the highest level of development-related staffing per municipality, and Parkland is among the lowest. I believe that this team capacity is one of the core pillars to rural development because municipalities with stronger capacities, they have better chances and are better positioned to attract investment, to support housing development, to plan infrastructure, to secure funding, and even to respond to population change, whether it increases or decreases. So to kind of conclude this, there's a strong connection between all of this team. And if there's one message I would like everyone to remember from this webinar, it is that these teams, they do not operate on their own. Population change affects workforce availability and economic growth. Economic opportunities influences migration and housing demands. Housing availability affects whether people can move into or retain or remain in a community. And capacity determines whether municipalities can manage themselves effectively. In simple terms, demography, this tells us what is happening. The economy tells us where opportunities exist. Housing tells us where pressures are emerging. And capacity determines whether these municipalities, these regions, can respond effectively. To achieve successful rural development, it's not about focusing on a single team. It's about understanding how demography, economy, housing capacity, transportation, well-being, climate change, all of this work together and are interconnected. Thank you very much. I will now hand it back to Michael.
Yeah, thank you so much, John and Charlene. So for those who haven't yet downloaded the report, I think a link has been posted in the chat. You can please click on the link and then download it. We want to close by also stressing that the Pulse 1.0 is exactly that, 1.0. This is just the beginning. the Pulse is designed as a living tool and a living report, meaning it will keep evolving as community data needs and priorities shift over time. RMED and RDI are already thinking about what the next phase will look like, and we want your input to help shape it. There are 4 big questions we are bringing to this conversation. First is, how do we evolve and improve the data itself? What's missing from the Pulse? Where do you want deeper coverage or more indicators or different breakdowns? We would like to hear about the gaps now than guess them later on. Second is, how do we best share and use the Pulse? We know and we are aware that the audience are different. Rural communities, municipal leaders, and provincial policymakers each need this information in different formats and at different levels of detail. And so we want to make sure that it lands well with each context. The third one is, how do we apply the data? Raw numbers only go so far. What kind of analysis, do you want to do? What kind of comparison, what kind of narrative interpretation would actually help you in planning, advocacy, or investment decisions? And fourth, how do we keep the 2.0 current as the 2026 census rollouts? Census data is released in waves, and we want to integrate new releases in near real time so that the Pulse stays most up-to-date picture of rural Manitoba. So it's now time for questions. If you have any questions and you want to ask, please feel free. Thank you so much. And again, you can find the reports on the RMED website. Again, the link has been posted in the chat. You can also find a link also on the RDI website as well. Thank you so much. Now open for questions.
No, and I think it's a really good example, Ariel, about how as we collect all of this data across the province and we collect all of this municipal data, that local context is really critical, right? And John did a really good job of talking through the different housing realities in some of the different regions. But as you flagged, that in some communities, those housing prices are driven by supply, and some they're driven by people from outside the community, and some they're driven by demand issues. And so while the Pulse gives a really important first sort of wave of understanding, that follow-up context in that local place and region is really key to sort of following up and making decisions on that. And you can see the same thing with population numbers, workforce numbers, immigration numbers. And so it's really critical that you have the data. And then a really important next step is to understand what that data means in your community. So I just really appreciate you raising a really useful example for making that point. So.
Okay, yeah, thank you so much, Wayne, for taking time this morning to join our webinars, and especially the Pulse of Rural Manitoba report webinar. I would want to say that you can always reach out RMED on our website if you want more information. Kindly reach out to me or through even to RDI if there's any further follow-ups that you want to do. Thank you again for your time, and do have a good day. Thank you.